We are here to launch the emergency medical mobile clinic uh, that was supported by the Kuwait Red Crescent Society. We know quite well that globally, disasters, epidemics, and all other forms of emergencies are occurring. They have been increasing in both magnitude and frequency. And basing on the mandate of Red Cross in Uganda, there is always a need or an expectation that Uganda Red Cross Society will always be there to support such situations. The Kuwait Red Cross Society has been supporting Uganda Red Cross Society since 2018, and when we presented one of the challenges as being lack of access or inadequate access to emergency medical services, they bought or agreed with our idea of having a mobile unit that can support in cases of emergencies. So, as Uganda Red Cross Society, as a board, we really appreciate the board, our governance, and the management of the Kuwait Red Crescent Society for accepting to extend this kind of support that is increasing our ability to respond to these medical emergencies.
We have a big relation with Kuwait Red Crescent and Uganda Red Cross, and we have discussed how to go together as a friendship. And we find out their suggestion to have a mobile clinic is a good idea. So we have given this mobile clinic to them, and of course we came here to Uganda to discuss also with Uganda Red Cross what other needs they want. As we come to Uganda, we find out how friendly the people are, how nice they are, how they welcome us, and how very generous they were with us. It's part of our humanitarian job in Kuwait to discuss and to help other countries. Since we've been established in 1966, we have done things for more than 100 countries around the world. Uganda maybe is the latest one, and of course we are discussing and we want to have a meeting tomorrow to see what else we can do. For us, a humanitarian thing is a big thing in Kuwait. It's either the government or the people. They like to help other countries.
For a long time, Uganda Red Cross has been working with partners to respond to refugee and internally displaced persons in emergencies. There has been a major gap in terms of how support is extended to the most vulnerable refugees, the most vulnerable persons, in terms of offering pre-hospital care services. What we have seen over time is that when such emergencies happen and people cross borders or are internally displaced, their injuries, some of the people who are most vulnerable sustain one, psychosocial support indifferences, but also they get affected by, say, fractures, they get bleeding, sometimes they have serious injuries to their heads, spines, to their whole body. That major gap has not been attended to, and that's why Uganda Red Cross, together with its partners, decided to pilot a disaster mobile clinic whose aim is to provide fast and rapid pre-hospital care services and be able to, one, provide stabilization of the casualties as soon as the emergency happens, and for those that are not being able to be managed on the scene are evacuated and taken for professional support to hospitals within the existing Ministry of Health structures.
We are honored as government and very privileged as the team in the southwestern region handling the humanitarian response that this is being launched and piloted in Nachi Valley Refugee Settlement, and which is a receiving refugee settlement and which is one of our oldest in the country. So we are honored that this addition to the humanitarian emergency health kit has been received. Of course, apparently we are witnessing reduction in donor funding, which is affecting all sectors and health inclusive. So having these additions to the humanitarian response is a plus for the humanitarian response teams, in that we will be able to serve and extend support to the communities in need. The Nachiva refugee settlement and the region has experienced very protracted refugee situation, and of course in there a lot of needs arise, and one of them is of course the increased health demand for both the old caseloads, so the old refugees, and also the new increasing numbers of the refugees, and also the neighboring host population, which also gets or benefits from the same services. So having this addition to part of our existing humanitarian structures, and specifically to the health response team, is a plus to the humanitarian team, is a plus to government, and we welcome and appreciate this support from the Red Cross.